Jobs.
Our next guests are fertility experts who recently went through their own IVF journey.
Dr. David Knight and Dr. Sonya Jessup knew their chances were slim when they decided to add to their family later in life. They join us now. Sonya, David.
David.
So
Sonya
you guys,
and David.
This is Sam, who is eating my pad.
Yes.
That's okay, my son eats it. He is child number 8. So you've got 7 between the two of you already, but from other marriages.
That's right.
Correct.
Okay. So why did you decide to go again? 7's a lot.
7 is a lot, but we had a small window. I was about 40 when we met, and we decided if we were going to have one more, that was the time. We knew fertility-wise, you know, that the chances go down in the 40s.
Yeah,
Sure.
And we like children, and we knew that we were going to have children around for a lot longer, and it's been a delight having him.
Yeah.
He's brought everyone together.
So, David, you're 51.
Yes.
Sonya, you're 43. So, and you're both specialists in the IVF field.
Run away, go on,
It's
run
like,
away.
Daddy, give it to me.
Go, run away.
So how did working in the world of fertility influence your decision or impact your decision?
I think it made us aware of the time frame. Like, you know, a lot of couples would be together for a while before they decided to have children, and we realistically knew that for us that wasn't an option.
Yeah.
So we had to make a decision fairly quickly.
Yeah.
Was there a cut-off point, though? Was there a time you thought, well, OK, if we don't do it by this time, you know, it's over?
Yeah.
We looked at doing it for 3 months to see how we went, what sort of responses we got, and then we'd reassess. And we were kind of lucky because on our 3rd month, we got, well, we didn't. Sonya got pregnant with Sam.
Yeah.
And so we were off and away. We looked at probably doing up to about 6 cycles.
Right. But you did 3, so you did 3 cycles.
Yeah.
Yeah.
What was it like being the patient rather than being the doctor, Sonya?
She doesn't cope very well with being a patient.
Busted.
In any evil. But, it was obviously much easier, I think, knowing a lot about the process going through it. So all the things that for some people are scary, like injections or the process, was relatively easy. And I think what made it much easier for me was that knowledge that it may not happen the first time, but that doesn't mean it couldn't happen.
Yes.
So we said, well, we're just going to do it for a certain length of time and then take it from there and see.
Let him go. I think there's Peppa Pig on there.
Okay.
There's Winnie the Pooh on there. Don't worry, my son's got a few things on there already.
There's plenty of things to keep him entertained.
What about then when you come back to your own patients, and you know, do you have more empathy, or did you already have that anyway?
I think I'm more structured with the patient, saying, look, if you do want this, you need to get started. It is a wonderful experience and it can work, but you need to give it a bit of a chance, you know. And I frame people a little bit differently. Rather than this is your one chance to do a cycle of IVF, it's like this is a process that assists you. You may need to do it a few times, and that's okay. You may be lucky. You may get pregnant the first time.
I fell asleep
But,
on my iPad.
He's trying to find Siri, I think.
It's in there somewhere.
What are some of the differences you've noticed now raising young Sam as compared with, you know, having children when you were younger?
I think it's fantastic. When I was doing my job at the start, I spent a lot of time away from the kids. And so I have an opportunity now to really be part of this little guy's life. I think it's brilliant. It's you know, Sonya aside, one of the best things that I've had happen to me for a long, long time.
Yeah. Because we have seen a lot of negative publicity about people leaving parenthood until they're old. I mean, what are your thoughts on that?
Let me do that. I reckon this is really important. Look, I don't think we can judge people for wanting to be parents again. I really don't. I've got a whole pile of friends that are my age, a little bit older, that have had kids in their 2nd or 3rd relationships. The world is a different place. We're good people. We know how to do this.
Yeah.
And I think we've got a hell of a lot more patience and time for these kids now as they're growing up. I think, as you saw from the last bit that you had on, that when you've got some structure around the kids, you can really produce someone that's going to be great for society.
Yeah. Look at
there's
you.
more fruit there. Apple,
Little Sam, he
Apple
is so
iPad, you
cute.
can have it all.
We're just blessed.
Thanks so much for coming on and talking to us, because we know a lot of our viewers are, you know, looking at IVF and thinking about it, so it is great to hear a success story. Thank you very much.
Thank you very much.
Dr. David and Dr. Sonya.
Boy, if only our parents would be so proud if that had happened. But here we are.
Let's get some news.